Hello everyone, I am urologist Omar Erdamakaya. Today we will talk about post-finasteride syndrome. Post-finasteride syndrome is a collection of complaints characterized by erectile dysfunction, loss of sex drive and depressive state after using the drug finasteride and has slowly started to take its place in the literature. It is a disease that has been studied thousands of times. The drug we call finasteride is a drug that was previously used for prostate enlargement under normal conditions, but during the period it was used, it was noticed that it was also good for hair loss and then it was labeled as a low-dose drug for hair loss. The special feature of the drug is that it does not convert testosterone into dihydrotestosterone. Dihydrotestosterone is a different form of testosterone, and in men with a genetic predisposition to hair loss on the scalp, we can say that it sheds, thins, and dries the hair. After using finasteride in people with hair loss, hair begins to grow thicker and more vibrant. It has been shown in many publications to be beneficial for hair loss, but some of the patients may have problems after use, and the rate of these problems is quite high, between 3% and 30%. When the publications reporting these side effects first came out, they were very criticized. It was criticized that these rates were too low. Because there is a significant difference between 3% and 30%. When we look at the FDA's side effect reports, finasteride has around 11% side effects. Among these response reports, there are thousands of cases of depression and dozens of suicides. There are many cases of suicide after taking finasteride, so much so that they have now established a foundation in the U.S. called the Post-Finasteride Foundation. There are also now thousands of lawsuits against the company in the U.S. for side effects. One of the most important problems of post-finasteride syndrome is that this depressive state and sexual complaints persist for a very long time. After using this drug, self-confidence, joy in life, and a positive outlook on life disappear. Patients complain about this the most, and I have heard directly from the mouths of many patients, "I wish I hadn't used this drug somehow, I regret it very much." I tell this because they sometimes ask, should I use this drug? Because of hair loss. No one can guarantee whether finasteride syndrome will develop after taking this medicine. It is necessary to say that the person can use it by taking this risk. In other words, if you accept this risk, you can use it, but people who use it and develop this condition really regret it. Because even after months and years have passed after stopping the drug, these complaints may not improve. Especially in young patients, it can have a devastating effect on their lives. When we look at the treatment, there is no complete treatment for post-finasteride syndrome. It is necessary to approach the patient from many angles. It is necessary to start with drug treatments that will improve the erection quality and sexuality of the patient. It is necessary to inform and support the partner. It is necessary to normalize the couple's sexuality again and reframe it from the beginning. It is necessary to evaluate many treatment options such as herbal treatments, chemical agents, alternative therapies, ozone therapy, neurotherapy. In fact, one of the most important problems in patients is depressive state and loss of joy of life. Therefore, the patient must be evaluated and supported from a psychiatric point of view. Post-finasteride syndrome is actually treatable in my experience. It is especially treatable in terms of erectile dysfunction and sexuality of the patient. But without eliminating the depressive state in these patients, it is very difficult to reach a complete conclusion about the patient's erectile dysfunction and sexuality. Because these patients can be stuck in the past. They can expect everything to be like in the past. For example, 10 years have passed, they may want everything to be as good as it was then. Therefore, it may be necessary to normalize the patient's sexuality again. And it is very difficult to say that this depressive state comes only from erectile dysfunction and loss of sex drive. Because this finasteride can sometimes trigger a mechanism in the brain of patients. It is not known exactly what it triggers, but it can cause this syndrome. It is not known exactly whether this is a coincidence or there is another reason. But one should not despair. Because I have seen people who have completely recovered from this syndrome. Thank you for listening. You can reach me via WhatsApp. Best regards.